On Tuesday, the CDC and FDA recommended a pause in the use of Johnson & Johnson's single-shot COVID vaccine. The guidance came after 6 cases of rare and severe blood clotting were reported among the nearly 7 million doses of the J&J vaccine administered in the United States. Public health officials scrambled to defend the move as concerns grow that the red flag will make even more Americans skeptical about ever getting a vaccine. NBC's senior medical correspondent Dr. John Torres has more in our Sunday Focus.
This morning, the Johnson & Johnson vaccine still on pause as an independent advisory committee continues to investigate a rare side effect, cerebral venous sinus thrombosis, or CVST. The extremely rare blood clot in the brain found in 6 women between the ages of 18 and 48 who had had the J&J shot. While these blood clots are dangerous, chances of getting a clot from COVID disease itself is actually much greater, and experts are urging the U.S. population to still get the Moderna or Pfizer vaccines.
There have been 6 out of the 6.85 million doses, which is less than 1 in a million. The fact that a pause was done, I think, just as a testimony to how seriously we take safety.
Before making any determination on the vaccine, the panel of independent experts will first investigate the blood clot cases to see if there are any common denominators.
For people who receive the vaccine, meaning within the last few weeks, they should be aware of their symptoms and immediately seek medical assistance.
These symptoms can include headache, shortness of breath, or pain in your legs or stomach.
I believe should increase people's confidence that they're being told what's going on. We want people to have confidence. The vaccines we are recommending are safe, they're effective.
But despite reassurance from health officials, the latest news has only fueled a wave of misinformation on the safety and efficacy of the COVID vaccines, which remain a highly politicized issue. Testifying before the House Thursday, Dr. Fauci grilled by Republican Congressman Jim Jordan in a heated discussion.
You're indicating liberty and freedom. I look at it as a public health measure to prevent people from dying and going to the hospital.
You don't think Americans' liberties have been threatened the last year, Dr. Fauci? They've been assaulted. Their liberties have.
I don't look at this as a liberty thing, Congressman Jordan.
Well, that's obvious.
2 polls released just this week both found 45% of Republicans are determined not to get vaccinated, creating concern in the medical community that vaccine hesitancy could impact the U.S. reaching herd immunity, the level at which we can safely pull back on some of the current restrictions. The good news, the U.S. is currently administering 3 to 4 million doses per day, and officials are optimistic about the continued rollout.
We have more than enough Pfizer and Moderna vaccine supply to continue or even accelerate the current pace of vaccinations.
Nearly half of American adults have received 1 shot of the vaccine, and more than 30% are fully vaccinated. Although the J&J vaccine makes up about 5% of shots in the U.S., it is largely favored worldwide, and experts worry this latest news could cause a ripple effect around the globe.
And Dr. Torres joins me now live. Dr. Torres, good morning. It's good to see you. So how do public health officials balance these 2 considerations? On the one hand, the safety of the vaccine, and on the other, the trust in the vaccine, making sure they're not scaring people off from ever getting the shot.
And Willie, that's going to be critical moving forward. The FDA, government, and public health officials all need to get that message out that these are truly 1 in a million cases, if at all, connected to the vaccine. And this is going to become even more important when the FDA restarts the Johnson & Johnson vaccine to make sure that they address that vaccine hesitancy issue. And going forward, this is going to become important as well because booster shots are going to come into play. Right now, Pfizer is saying it looks like we'll need them at 12 months. Moderna is actually looking at developing a combination flu and COVID vaccine. And so, again, moving forward, addressing that vaccine hesitancy is going to be the key.
Yeah, like any shot, we're all likely going to need a booster down the road. So interesting. Dr. John Torres, thanks so much for that report. By the way, Dr. Torres has a great new book out called Dr. Disaster's Guide to Surviving Everything. And he does mean everything. Check it out.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.